In this video, I will be analyzing the dynamic and mobility assessments of my client. In the anterior view of gait, I did not see any turning out of the feet, valgus or varus knees, or asymmetric weight shift. In the lateral view of gait, I did not see excessive posterior or anterior pelvic tilt. In the posterior view of gait, I did not see any excessive foot pronation. When observing the client's Davies test from an anterolateral view, I saw excessive trunk movement. From the anterior view of the depth jump assessment, I noticed the client landed on her right foot just before landing on her left foot. This is asymmetric contact and landing on the ground. From the lateral view, I noticed some excessive forward trunk lean. In the overhead squat assessment with no modification, the client has excessive forward trunk lean and her arms fell forward. I did not notice any turnout of the feet, valgus or varus knees, or asymmetric weight shift. With the hands on the hip modification, it did not improve her depth or her forward trunk lean. With the overhead squat assessment with the board underneath the client's heels, the client was able to improve her forward trunk lean, her arms did not fall forward, and she increased the depth of her squat. For mobility screening, first I would suggest foot and ankle screening to look at ankle mobility and flexibility. For foot and ankle screening contradict the prior finding of poor ankle mobility in the overhead squat assessment because she is able to touch her knee to the wall without compensation in any other aspect of her foot and ankle. Because of the forward trunk lean, I would also do knee screening mobility tests. This includes the Duncan-Ely test and the active knee extension test. The client's Duncan-Ely test shows that she has overactive quadriceps in both legs, but her right quadriceps appear more overactive than her left quadriceps. The active knee extension test shows that she has overactive hamstrings in both legs because she could not get her legs to full extension. It appears that her left hamstrings are more overactive than her right hamstrings. I next chose to perform the modified Thomas test. She has restricted knee flexion in both legs, which is caused by an overactive rectus femoris. She also has some hip abduction in both legs, which is caused by an overactive tensor fascia lata. Then I chose to perform the shoulder flexion test due to the arms falling forward in the overhead squat assessment. It appears she has overactive latissimus dorsi because she has some scapular elevation and her arms do not fully touch the table due to elbow flexion. I then performed the shoulder extension test and it appeared the client had normal mobility. I performed the dynamic assessments and then those are the mobility assessments I chose,